Hello everyone, welcome back to the Ladies Guide. My name is Deanna Tikhonov and I'm a women's health nurse practitioner. On today's birth control series, I'm going to be talking about the natural family planning method. I know that's a mouthful, but it's also known as the fertility awareness method or the rhythm method, you might have heard it called as. And this is a method that is actually completely free. It's accessible to everyone, and it's something that has no side effects to it. There's no hormones, there's no medications to take, and it's something that can help you determine the days that you're fertile to either help prevent a pregnancy or, if you want to achieve a pregnancy, to know the best days to have intercourse. So it's something that does require a lot of dedication and commitment on your end, but if you're motivated, it could be a great way to learn more about your body and to have an idea of how our bodies work on the day-to-day that we have usually no real idea of the amazing things that are going on every single day in order to create a baby. That's kind of the point of a lot of these changes that occur, but it's a great way to get in tune with our bodies. So if this sounds like something you might be interested in and want to learn more about, then definitely keep watching. So this method is really most effective if you have a period that is every month. So it's okay if your cycles aren't perfectly every 28 days or even every 30 days. That is really okay. You know, there's going to be slight variations, but the important thing is that you are getting a period every month. So whether that looks like the date might be different. I commonly have patients tell me that, oh, I get my period every month, but sometimes it's on the 3rd, sometimes it's on the 5th, and that's totally normal. But if you're skipping your periods for a month or two at a time, then this method is probably not the best way to help you determine the days that you're fertile, because it could be more difficult for you to really do that. So this method really should be used for women that have a monthly cycle. So a cycle means from day 1 of your period to when the start of your next period is, how many days until the next period. So the average cycle for most women is 28, but there's definitely a lot of variations. So the first step in order to make this method most effective is to track your cycles for about, I would recommend 3 to 6 months to really get an idea of the lengths of your cycles on average, because everyone's will vary slightly and there could be different variations depending on if you're under more stress, whether it's emotional stress or physical stress or traveling where there's a time zone change. All of these things impact our cycles and can throw off when we ovulate and could change the date of when ovulation occurs, or maybe doesn't occur at all. So it is important that you're tracking your cycles really for about 3 to 6 months before using this as a primary method to prevent pregnancy, because it can take a little bit of time to really learn when you are ovulating. So a great way, we all have phones these days, track it in your phones. There's a lot of free apps out there as well that will help you track your periods to determine when you are ovulating and your average length of cycles. It kind of does that all for you through these apps. So as long as you're recording that data, then you can use that moving forward once you're ready to start using this as your primary method of birth control. So that is technique number 1, that's very important with the natural family planning method, that you are tracking your cycles. It's also known as the calendar method. So that's the first part. The second step, in order to make this more effective to determine when you're fertile, is checking your body temperature every single day, first thing in the morning, before you've even gotten up out of bed. So it's best to keep a temperature thermometer at the bedside and check your temperature first thing in the morning, and you're going to record that. Again, we all have phones, so you can record it in your phone, or if you want to do it old school, write it down in a little notebook. So by doing this, our bodies actually, when we're about to ovulate and during ovulation, the body temperature goes up about 0.5 to 1 degree Fahrenheit. So if you're tracking your periods for, again, several months, and you're checking your temperature for several months, you'll be able to notice the trend of when your body temperature has increased, and this will give you a good idea of the days that you are likely fertile. So this does sound a little daunting for some, but with the right motivation and dedication, it's definitely something that's possible. And again, it's a great way. I get a lot of feedback from women that they feel like it's pretty cool to notice these little changes that are going on in their bodies that they normally wouldn't. So it's pretty nice in that sense, but it does require some work on your end. So the third technique to make this most effective is checking the cervical mucus every day. So our cervical mucus actually changes throughout our menstrual cycle, and during ovulation is when it's usually the clearest and when it is the slipperiest and stretchy in consistency. And this helps again to determine when you are ovulating. So when you're using the calendar method, tracking your cycles, when you're checking your temperature and you're checking the cervical mucus, you can use all three of that information that you get from those techniques to determine your fertile days. Now, I say fertile days, not fertile day. It's not just one day. So it is important that you keep that in mind, especially if you are trying to prevent pregnancy, that it's not just one day of the month that you have to avoid having intercourse unprotected. Because although when an egg is released in a woman's body, it really only lasts about 24 hours from the time it's released. However, sperm could live in our bodies for up to 5 days. So if you have intercourse a few days before you ovulate, and you ovulate 2-3 days later, there is a chance that the sperm and egg can meet and a pregnancy can occur. So it's very important that ideally that you're avoiding pregnancy for about 5 to 6 days once you determine what your fertile window is. And of course, if you are trying to achieve pregnancy, then this would be the best time to have intercourse to increase your chances of getting pregnant. So again, this is an overview. This doesn't replace seeing a medical provider in person, but it gives you the tools, and honestly, this is a method that you can absolutely do. You don't really need any permission from a provider. I will just say that it's just very important that you are having regular monthly cycles. If you're skipping periods at a time, then this is not a good option for you, because it's probably going to be extremely difficult to determine when you're ovulating and could make it more challenging. So as far as how effective it is, it can be up to 90% effective, but it's variable for people because it does depend on your dedication, and it also depends on your cycles, that they are coming regularly and there's nothing else going on that's impacting your cycles, like stress, physical, emotional, or traveling with time changes, which actually does all change when your cycles can be sometimes. So it can be up to 90% effective. The failure rate is a large range. It's actually between 2% to 23%. So that's a large range of if it might not work. So, take all this information in and really reflect on if this sounds like something you might want to try. It's something that women who use this method usually either love it or hate it, because again, it does require more work on your end, but it depends on how you look at it. You might look at it as a great way to empower yourself to learn more about your body, and then this might not seem so daunting to do every day and tracking your cycles. So I really hope that you enjoyed this video. Thank you so much for watching. Please don't forget to comment below and to ask any questions, any clarifications you have, any topics that you want me to cover in the future. I love your feedback, and check out my Instagram. It's @_the ladies guide. I go through a lot of different information based on the video that I'm about to do each week, so you can gain some more information and interact with me on there. Thank you so much, and I look forward to my next video.